Hello, my name is Belen Herrera and my topic is Assigning Children Risks for Dental Caries and Parental Preventive Practice. Definition: Early Childhood Caries (ECC), according to the American Dental Association, is the presence of one or more decayed now cavity or cavity lesions missing due to caries or filled through surfaces in any primary through in the preschool age child between birth and 71 months of age. Bottle feeding during night sleep, unhealthy diet with high sugar consumption, lack of parental awareness regarding their children's oral health, low socioeconomic status, and lack of access for dental care were all reported as risk factors for ECC.
Take a look inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces, which require the removal of more healthy tooth structure to fix. It's also where most gum disease begins.
Applications in odontology. A healthy mouth and healthy body go hand in hand. Professionals and other members' decays can be prevented with the joint action of both good oral hygiene, the reduction in the consumption of sugar in the diet, and a regular and adequate use of fluoride and key elements for effective caries prevention strategies.
Why do kids get so many cavities? How to prevent cavities in children? What is tooth decay in children? Tooth decay is the breakdown or destruction of tooth structure caused by bacteria-generated erosion and leads to cavities or caries, which are essentially holes in teeth. What causes tooth decay in a child? Tooth decay commonly happens when food containing carbohydrates, sugars, and starches are left on the teeth. Such foods include milk, soda, raisins, candy, cake, fruit juices, cereals, and breads. Bacteria metabolize these carbohydrates and produce acids. The combination of bacteria, food, acid, and saliva form a substance called plaque that sticks to the teeth. Over time, the acids made by the bacteria erode tooth enamel and can progress into the dentin layer, causing cavities. The following factors increase the risk of your child having tooth decay. High levels of the bacteria that causes cavities, example S. mutans, a diet high in sugars and starches, especially soda pop. Water supply that has limited or no fluoride in it, poor oral hygiene, less saliva flow than normal, lower pH saliva, which is more acidic. What are the signs of tooth decay in a child? Chalky white spots that represent decalcification of the enamel begin to form on the teeth in areas affected. This may lead to early sensitivity in the teeth. When early cavities appear on the tooth, it has a light brown color. The cavity becomes deeper. It turns a darker shade of brown to black. The symptoms of tooth decay and cavities vary from child to child. Cavities don't always cause symptoms. Sometimes children don't know they have one until their dentist finds it. But your child may feel the following: pain in the area around the tooth, sensitivity to certain foods, such as sweets and hot or cold drinks. How is tooth decay diagnosed in a child? Your child's dentist can usually diagnose tooth decay based on a complete dental history of your child, an examination of your child's mouth, dental x-rays. How is tooth decay treated in a child? Treatment will depend on your child's symptoms, age, and general health. It will also depend on how severe the condition is. In most cases, treatment requires removing the decayed part of the tooth and replacing it with a filling. Fillings are materials placed in the teeth to repair damage caused by tooth decay. They are also called restorations. Typically for children, direct restorations are used. These need a single visit to place a filling directly into a prepared hole. These fillings may be made out of amalgam or resin composites. Stainless steel crowns may also be cemented in place where there is substantial destruction of tooth structure. How can I prevent tooth decay in my child? You can help prevent tooth decay in your child with these simple steps. Start brushing your child's teeth as soon as the first one appears. Brush the teeth, tongue, and gums twice a day with toothpaste, or watch as your child brushes his or her teeth. For children younger than 3 years old, use only a small amount of toothpaste, the size of a grain of rice. Starting at 3 years old, your child can use a pea-sized amount of toothpaste. Floss your child's teeth daily after age 2. Make sure your child eats a well-balanced diet. Limit or eliminate snacks that are sticky and high in sugars, such as chips, candy, cookies, and especially soda pop. If your child uses a bottle at bedtime, only put water in it. Juice or formula contain sugars that can lead to tooth decay. It is recommended that you avoid bottle feeding your child after they are 1 year old. This will prevent orthodontic problems such as a narrow arch and anterior open bite. Talk with your child's healthcare provider or dentist about using a fluoride supplement if you live in an area without fluoridated water. Also, ask about dental sealants and fluoride varnish. Both are put on the teeth. Schedule routine dental cleanings and exams for your child every 6 months.
Pros: saliva flow and components protein. Some foods contain factors that protect against dental caries. Antibacterials, fluoride, calcium, phosphate, proactive dietary components. Non-cariogenic sweetener. Cons: acetogenic bacterium, mutant lactobacillus, and streptococcus. Reduces salivary function, biofilm formation, and retention. Reduces all diaphragm.
Another oral health fact from the BC Dental Association with Dr. Bruce Ward.
Early childhood tooth decay is the most common chronic disease for children under 5 in BC, and it's preventable. Some people think baby teeth aren't important, but they are. They directly affect speech development and confidence, play a key role in your child's ability to eat healthy food, and they make space for adult teeth. Here are some important steps to help prevent early childhood tooth decay. Make sure the dental health of the main caregivers is good and they have good oral hygiene habits. Don't give your child anything but water at bedtime. Brand new baby teeth are very soft and at high risk for decay. Limit sugary food and drinks throughout the day. Gently clean your child's mouth and teeth along the gum line every day. And starting from age 1, make regular dental exams a priority to ensure that you're on the right track. Visit our website for more prevention tips and resources.
Be aware, be informed, be active in your child's dental health. To learn more, talk to your dentist or visit yourdentalhealth.ca.
Conclusion: most of the children reported unacceptable dental attitude knowledge. However, there was lack in the association oral health practice, of which lack of clinical time was reported to be the main barrier. As a result, more efforts are encouraged to engage and facilitate the provision of the required oral health assessment in the pediatric and the family medicines clinics, along with increasing the interaction between pediatricians and family physicians with dentists.